So this video is about Pica, which you've either heard or haven't heard of this, which this is an eating disorder, which a person usually eats something that is not really considered food. Young kids often put non-food items like grass or toys in their mouths because they're curious. But kids with pica, I meant, well, I sometimes confuse it with Pikachu, but it's pica, by the way. Sometimes they eat things that can lead to health problems. What are the signs and symptoms of pica, you're probably asking? People with pica crave and eat non-food items such as dirt, clay, rocks, paper, ice, crayons, hair, paint chips, chalk, and feces, which I've seen some people do it. It's weird. Well, I haven't actually seen it, but I've seen like cases of it. Health problems can happen in kids with pica depending on what they eat. These can include iron deficiency, anemia, lead poisoning from eating dirt or paint chips with lead, constipation or diarrhea from eating things the body can't digest, like hair, intestinal infections from eating soil or feces that has parasites or worms, intestinal obstruction from eating things that block the intestines, mouth or teeth injuries. What causes pica? Doctors don't exactly usually know it. But it's more common with like developmental mental problems such as autism or intellectual disabilities, mental health problems like OCD or schizophrenia, malnutrition or hunger. Non-food items might help give a feeling of fullness. Low levels of nutrients like iron or zinc might trigger specific cravings, or just simply stress. Pica is often seen in kids living in poverty or in those who've been abused or neglected. How is pica diagnosed? Like, if they've been doing it for at least a month, the behavior isn't normal for the child's age or developmental stage. The child has risk factors for pica, such as a developmental, disability. They might even also check for anemia, lead levels. How is it treated? Well, doctors can help by like preventing kids from getting the non-food things they eat. They may recommend childproof locks and high shelving to keep items out of reach, or just need a psychologist. It's an interesting fact. Yeah, but it's also like usually associated by iron deficiency. It's a very interesting case. I mean, it's pretty interesting. But also, thanks for watching, and now you know the meaning behind Pica syndrome, not Pica.